I think, what is the best case scenario? What is the worst case scenario? You know, can we maybe see the thing from the wrong side? You know, so when we think evil, as a lot of professors have warned, saying, look, the vaccine can have the reverse effect. It can amplify the impact of the virus. It can have an ADE, you know, autoimmune...
antibody-dependent enhancement.
Exactly.
And that is one thing. And other thing, some people had warned is that it can promote mutation.
Yes, exactly. So there are a lot of, you know, that I just learned that in the official VERS register, the list of possible side effects is quite long. It's 64,000 different side effects which are noted right now. So it's a long list of things that can happen. But a lot of them are similar to the symptoms of COVID, because there was also the narrative, COVID can have, you know, impacts on this and that. It can be different organs. Everything can be COVID. So I am quite critical if we talk about COVID in 2021, even if only 7% of the population has been vaccinated at this time. Who knows? I mean, the numbers. Here we're talking about per million. So if we talk about 7% and every fifth person has a problem, it can have an impact on these numbers. What is your opinion about this? Can it be linked to the vaccination, or is it sure that this correlation is not existent?
India is a very big country, and of course you are right. And another problem with India is that some parts of India may be more vaccinated, others may be less. But I have seen this phenomena of rise in cases and deaths in smaller countries like Sri Lanka.
I see.
Sri Lanka I was following very closely, because
tell me, I want to learn. How exactly did it evolve in Sri Lanka?
Sri Lanka was having very less cases per million and very less number of deaths. In fact, 10 times less than India. I was following all the neighbors because I was worried about our country, and I thought the demographics of India's neighbors like Bangladesh, Pakistan, Sri Lanka is more comparable than European, because most of these planners were just adopting the Western models. Yes. So I said these things are different for many reasons. One is of course the obesity and age, and other very important thing I thought was the population density. All countries like India, Bangladesh, Sri Lanka are 10 times more crowded than the Western countries. Oh, really? So if the natural infection has to spread, which I have seen firsthand in my work area, where the 80% people were already having the antibodies from natural infection. So I saw Sri Lanka was almost a baseline. And after the vaccine rollout in say 21, and these cases increased and the deaths have increased. Similarly, Sri Lanka I saw. Then similar phenomena I saw in Malaysia after the vaccine rollout. So that makes us worry whether it is due to any either waning immunity of the vaccine, or another thing they say is people become careless after they get the vaccine. They make more. It may be that. I mean, sure. But Japan did not have a lockdown. Japan was also having almost less than India deaths.
Do you want to show some graphics?
Yes, I can show that graphs. Japan also, after the vaccination, they are not faring so well.
Oh, really? Wait a moment. I'll make it big. No, this is the wrong document. Sorry.
No, this is...
yeah, but I had it as a PDF somewhere. One moment. Sorry. This is certainly wrong. Yeah.
No, this is the one. This is, I think, Japan.
Yes. I don't know. Can
this is Japan.
Yes.
This is the...
Make it a bit bigger.
So before March 2021, the cases were almost baseline. After they rolled out the vaccine in March, April, and then May, and now it has got one of the highest vaccination coverage, 79% coverage in Japan, where they don't have any vaccine mandate. They educate the people. They never had lockdown. You see the cases started spiking, then now it is spiking. Either the immunity is coming down. So before vaccine, baseline, after, and then this is the deaths in Japan. So they had high deaths, of course. But after the vaccine also, it didn't, almost symmetrical. I mean, you expect the deaths to come down. If you claim that vaccine prevent deaths, at the population level, you should see the big picture is not, and now the deaths has spiked compared to pre-vaccine era.
But tell me, I don't understand. When did they really only roll it out in April? Because in Germany, they started to vaccinate in December 2020.
Germany, they started, UK was the first country in December.
Yes.
It's in
Beginning of January, let's say.
we saw the
Germany.
UK figure also. We can show that.
Oh yeah, you want to go?
UK also we are having the similar type. Even
This is Singapore. Sorry, I make it a bit
Singapore also we are having the same.
Here is UK. Here is Singapore. So what should we look at first?
Yeah.
UK. I make it big. One moment. Here we are.
This is the UK.
Ah, I see.
See, UK December they rolled out the vaccine. After vaccine there is a spike which is higher than the pre-vaccination spike.
But again, these are the numbers which
These are the
are
deaths.
also a bit falsified, as we don't trust.
No,
the deaths.
like look here, Robert. One thing is there. These numbers we don't trust. These numbers also we don't trust. We are using the same methods.
Yes, so you
it's-
can compare. them.
Compare.
This is how you think as a scientist. It
That's
makes sense.
epidemiologist has to improvise, no?
Yeah, exactly.
We have to whatever data is available.
Yes, okay.
So that is why these comparisons matter more.
Yeah.
Okay, the same country I am comparing.
Yeah.
Earlier you can say ki here data Africa is less, better data in Europe. Here it is I am comparing UK with UK.
Yeah.
If they are using one method, the same methods they are using now. And they are having, you see, after the vaccine they spike and then again it may, what happens is that those who are vulnerable who die, they can't die second time. So after that, and then many people, even if it spreads, many people develop natural immunity.
Yes.
And therefore it comes down on its own after causing the harm.
Mm-hmm.
And there are other countries also. I can.
So I make it small again.
Singapore is also having the same problem.
Singapore is here.
You see, this is the vaccine rollout.
Oh, I see. Okay.
64%. This is the.
So here.
No, this is USA. USA is also having same problem.
Sorry, I was wrong.
In fact, I had a panel
Here's
with
Singapore.
Knut Witkowski of USA. He said these vaccines are not working. He is very blunt. Knut.
Who said this?
Knut Witkowski.
Knut Witkowski. Yeah, sure.
I was a couple of panels with him.
Yeah. Oh, really?
Huh.
Where was it?
Macmillan, Philip Macmillan's panel.
Oh,
I will
see.
send you the links.
He's from the Rockefeller Institute in New York City.
So we are
German-born.
Yeah. We are in touch. In fact, we have been on a couple of panels together. Three panels together.
I see.
I will send you the links.
He's very cool. He has this straight way of saying
straight way, never misses word. And we clicked also.
I see. Oh, this is impressive. So you have like no cases beforehand, and then you have a lot of cases.
This is Singapore. See, I mean, how do you justify population level mass immunization with this data which a high school student can see? I mean, these are just pictorial. And this is data in the public domain. This is from Worldometer and this is from the vaccine tracker. Both are available in the public domain.
I don't know. And do they have the vaccine is mandatory in Singapore, isn't it?
Except in Japan, where it is not mandatory, but they have the highest intake.
Yeah, sure. Because maybe
they have a faith. They have a faith in the authority.
They trust exactly. They trust in the authority of the state.
Yes.
And so that doesn't need to be mandatory.
Doesn't need to be mandatory.
Yeah, I see. Wow, this is really impressive. I mean, this is like the most impressive graph.
You can see other countries. I have whatever country I have seen.
This is USA.
USA. See, these are the cases in USA, and this must.
One moment, I make it small so it's easier to see.
This is my cases. This must be the deaths. This was the deaths. This was the cases.
I see. Amazing.
And this was, I think, this is.
This is Israel.
Sri Lanka. I keep track of Sri Lanka, neighboring country.
Yes, this is good.
You see, it was almost cases were baseline before the vaccine. After the vaccine, cases are surged. See, these deaths. So I was really surprised at Sri Lanka because every time I used to compare it with India, it was doing so well.
So what is it? Wait, I have to understand this. Trend of COVID deaths in Sri Lanka.
After the vaccine, deaths some more. The same cases are more. These are the cases in Sri Lanka.
Cases, death. Okay, let's look at the death curve, because this is always more important, I would say, because you cannot fake a death. Not so easily, at least. Wow.
And whatever limitations in data quality is before same country, before and after the policy. Now,
so there's the testing here too.
The testing and whatever for deaths as well as for cases. They didn't change the policy. Now I think gradually, now they are saying ki no need to test now, because they are finding it embarrassing ki so many deaths are occurring. Maybe that reason.
So I mean this.
And as an epidemiologist,
so here's a story of you're vaccinated, you're risking more.
I mean, population level, as an epidemiologist, I don't see individual, I see population. So I am not happy with the health of the population after vaccination. I mean, the data is there, or somebody has to explain to me what's happening.
Yeah.
Whatever, that is for the deaths. But if I am seeing the bigger picture, I see something which is...
But in the bigger picture, you will have also to see whether there
disturbing.
are more people dying altogether. Can you say this? Whether there are more people dying altogether?
Maybe that because the other health conditions were neglected during the lockdown.
You might know Professor Kubantner in Germany. He made a study seeing the overall death. He took the numbers from Professor Fenton in London, and then he adapted it also to the German numbers. And he found out that the vaccine rollout, and especially the booster, that you can see it in the overall mortality of the region where the booster has been implemented. And the peak of the plus mortality is different in Berlin than in Munich, according to when the booster has been rolled out. So there's a very strong correlation, not even like this, but it's really like the week where the booster is rolled out, you have more people dying than average. And this, we had a narrative together some weeks ago, and this was very impressive to me, and I think it had also an impact on the vote. The German parliament voted now against the mandatory vaccine. It's a very recent decision, and I wonder what this will lead to. And other people fear that maybe through the European Union, mandatory vaccine in Europe will be implemented anyway, or it will come back again. But I mean, this is so clear; it cannot be clearer.
It is just putting these things are lying for everyone to see, scattered. I have just put it together, and it is telling a story.
Thank you for this work. And what does it make? What does it tell about our society?
I think what is happening is we are losing out on the art of medicine, art of public health, where you have all these things, judgment. Now everybody is looking at, virologist looking at that virus, clinician is seeing that, and from distance. They are not adding up together. When you just stand aside, like art requires something which you can't explain. So they are just trying to explain things in a scientific way, where medicine, because there is a lot of human variations. And another thing which I find very, very wrong in this pandemic, this mass vaccine rollout was never done for a disease with 0.1 mortality or 1% mortality. There are so many diseases we have got, particularly in poor countries, 5-10% mortality, even with treatment. So that was one thing. Secondly, it is still under experimental use authorization. Experiment should have a control group. Yes. If you are giving a mass vaccination, where is your control group? Who has ethically cleared such a study without a control group? Even small studies, you require a randomized trial. You could have randomized some communities in each country to get the vaccine, some countries not to get, and then compared. Now here it will be very difficult. They will say, no, it may be due to COVID, they had a prior, whatever, they will try to cover up due to other disease. Like this, deaths are due to other diseases, like many people did not have proper treatment, cancers were neglected, heart disease were neglected. So this spurt may be due to that and incidental, the same they will use what we are trying to use. As a misdiagnosis, they will use the same and get away with it. But if you have a control group, some communities given vaccine, others not given vaccine, and then you can compare, it would be very clear. Because it is an experiment, so you should have a control group and experiment. But they have, I mean, I would say they don't want that strong evidence. In the court of law, it is tampering with data. I told Advocate Oja that don't leave any evidence for you to.
Wow, yeah, but this sounds like premeditation. Yeah, and
Yeah, I'm not happy with. I mean, whatever it is done in a very amateurish fashion. Amateurish fashion, like we have a lockdown first 2 weeks so that hospitals are not overwhelmed. Then okay, let us. The vaccine is coming. Now just extend it. We have a vaccine and then people will come out. And now vaccine has come. We had a lockdown for 2 years. Schools were closed. And now we have lost everything. Now vaccine is also not. And now we are spending on boosters. I mean, India has spent, I think, 135,000 crores on vaccines for COVID, and they are trying to vaccinate the children, where not a single, perhaps, child has died of COVID in this past 2 years, a healthy child. And as I said, 2,000 children are dying of other diseases.
yes.
Spend money